Hello and welcome to Health Matters. I am Mary Alale Yusuf. It's another day of Health Matters. It may surprise you to know that bone is a living tissue. It is constantly being absorbed and renewed. Osteoporosis happens when the production of new bone does not match the removal of old bone. This progressive bone disease can occur in any age group and any gender, but is more common in older Caucasian and Asian women. A 10% loss of bone mass in the vertebra can double the risk of vertebral fractures. On the program, ready to delve into this matter, is Dr. Ishaq Ojodu, who is a consultant orthopedic and trauma surgeon with Cedar Crest Hospitals in Lagos. You're welcome to the program, Dr. Ojodu.
Thank you very much.
Let's start off right away. That's a rough explanation of what osteoporosis is. You may have a more detailed one. So okay. What is osteoporosis?
Thank you very much. Osteoporosis, to put it in a layman's language, it's just porous bone, okay? And it means the bone loss exceeds bone formation, as you have mentioned in your introduction. And it is characterized by three things. One, there is decreased bone mass, there is altered bone tissue, and altered bone architecture. These three things make up osteoporosis. And eventually they will lead to fragility or thinness of the bone, which increases the risk of fracture or breakage of the bone.
Now, I'm curious, being a woman, why are women more at risk of this osteoporosis?
Thank you very much. It's been said that 1 out of 2 women will have osteoporosis-related fracture in their lifetime.
50%,
50%
of the population of the world?
Yes. Whereas 1 out of every 4 men will have osteoporosis-related fracture in their lifetime. The reason being that the estrogen, that is the female hormones, okay, is responsible for bone growth and development. And once it stops at menopause, the osteoporosis, bone loss, exceeds bone formation. And that is why women are more likely to be predisposed to osteoporosis than men.
I'm going to take you up on that immediately.
No problem.
Women have estrogen.
Yeah.
Men don't have estrogen.
Yeah.
What's responsible for the bone formation in the man?
Yeah. There are so many factors that are responsible for bone formation or substances in the bone. One is osteoclast, which is responsible for bone resorption, and one is osteoblast, which is responsible for bone formation. Okay, you must have a balance between the activities of osteoclast and osteoblast to have a level, a normal equilibrium. Okay, but if the activities of osteoclast is more than the osteoblast, then you have what we call osteoporosis.
Okay.
Okay. Then the estrogen in women, okay, prevents the osteoclast from functioning properly. Okay. The
so there's now
years,
an imbalance.
An imbalance at menopause. Okay. Also note that osteoporosis is also related to age.
Okay.
Okay, and that occurs after age 70 years. After age of 70. Okay, both men and women are more likely to develop osteoporosis.
At that time?
At that time.
Okay, I understand about the osteoclast and the osteoblast.
Yeah.
But before, menopause and all that, do men have estrogen? Let me ask that
We
first.
have, but in small quantity.
Okay, so what in them is responsible for their bone formation?
Okay.
Such that women are more prone instead of them.
Okay. Men have testosterone, the male hormones, the male sex hormones, testosterone, the main one. Okay. And these interact with with other constituents in the body, okay, to assist in bone formation. Okay. Whereas in females or in women generally, estrogen contributes more than 50% of the strength of the bone. So that when the menopause happens, then you have the occurrence of osteoporosis more in women than in men.
Okay.
Yeah.
apart from age
Yeah.
and gender,
Yeah.
what are the other risk factors? Are there any?
Yeah. Thank you very much for that question. Some studies have divided the risk factors into modifiable factors, which you can work upon to improve the strength of the bone, and some are non-modifiable factors that you cannot do anything about or except to do some preventive measures. The modifiable factors are: one, smoking cigarettes.
Okay.
Okay. Then excessive intake of alcohol, more than 3 bottles per day.
3 bottles of what?
Yeah. Predisposes to osteoporosis.
Is it beer or, hard
Alcohol.
spirits?
Alcohol.
Any alcohol.
Any alcohol. Then if you have frequent falls, because osteoporosis, once you have an osteoporosis-related fracture, you are predisposed to having another one.
Okay.
Okay. Then one of the preventive measures is to prevent frequent falls, especially in the elderly. Okay. Another modifiable factors are: one, poor nutrition, inadequate intake of calcium and vitamin D. Okay, and high intake of salt and high intake of caffeine. Okay, have all been regarded as risk factors, modifiable risk factors
to
for osteoporosis. Yeah.
Okay. Now, what are the symptoms, or does osteoporosis have symptoms?
Thank you very much for that question again. Osteoporosis, like hypertension and diabetes, it's a silent disease. Okay, it only announces itself after a fracture. Once a fracture, then you suspect that it
could be osteoporosis.
Has osteoporosis.
Okay, since it's a fracture that announces that it's osteoporosis, what does one do to make sure they find it out before the fracture?
Thank you very much again. WHO, in his own definition of osteoporosis, came up with the values of DEXA scan, that is dual energy X-ray absorptiometry. Okay, the scores from that have been categorized into 4. Okay, we have a normal study, you have osteopenic study, you have osteoporosis study, and then severe osteoporosis. Okay, the values will categorize you into one of these. Okay, but how can we detect? Okay, the risk factors I've mentioned, I forgot to mention the non-modifiable risk factors, and which are age, the female gender, the family history, the previous fracture of the history of osteoporosis fracture, ethnicity, race, as you said in your introduction, common in Caucasian than in blacks. Okay, and some medical conditions like rheumatoid arthritis, Cushing's syndrome, hyperthyroidism, hyperparathyroidism, and so on and so forth.
Okay.
Also medications like anticonvulsants, okay, heparin, lithium, and glucocorticoids, steroids, for more than 3 months.
Steroids, that's for allergies.
Yes, but if you take it for more than 3 months at a particular dose, will predispose an individual to osteoporosis. Okay, once we assess their risk factors, then we'll now say, okay, you go for the BMD testing, that is bone mineral density test or not. The indications for this test are: one, if a woman that is 65 and above